Alright, so we're doing the male reproductive system today. So let's start off with sperm production and work our way out. So we start off with the testes, and the testes are going to be covered by a tunica albuginea, and around that, the outer layer that you can see here is something called the tunica vaginalis. Tunica vaginalis is an extension of the peritoneum. So there is a visceral layer on the testis itself, and there's a parietal layer within the scrotum. Okay, the structure as a whole is the scrotum. Okay, so here's what's happening. We make some sperm inside the testes. Sperm enters the epididymis. It goes into the head, the body, and the tail of the epididymis, and that will turn into the vas deferens, which I'm following the path of it right here. Vas deferens comes up and over the bladder, and it has an ampulla of the vas deferens. This right here, just anterior to the vas deferens, is the seminal vesicle. So what happens is when ejaculation occurs, the ampulla of the vas deferens contracts and the seminal vesicle contracts, and those two guys meet up in this ejaculatory duct right here. The ejaculant will pass through the ejaculatory duct, and it will enter the prostatic urethra, go into the membranous urethra, and exit the penis. So here's our prostate gland, right? And as I was saying, this is the ejaculatory duct, and this is the prostatic urethra. This little part right here by the urogenital diaphragm is called the membranous urethra, and then we go into the spongy urethra. This right here is called the bulbourethral gland. Another name for that is the Cowper's gland. This is the bulb of the penis. Alright, and then we get within the body of the penis there's going to be a corpus cavernosum, and there's going to be a corpus spongiosum. We'll see a picture later on where you can see what that looks like much better. And then this is the glans penis and the foreskin, aka the prepuce. So our accessory glands, we have our seminal vesicle, prostate gland, and bulbourethral gland. The seminal vesicle will make most of the volume of the semen, and it will produce a viscous alkaline fluid. Alright, it will also have some fructose and ascorbic acid and coagulating enzymes. So here's what happens. This guy produces alkaline substance to break down to decrease the acidity of the vagina. There is fructose around to give the sperm cells or semen energy. They're very tiny cells. They don't have a lot of cytoplasm. They don't have a lot of energy stores, so this is their little lunchbox while they're going on their journey. Coagulating enzyme. There's going to be this coagulating enzyme, so when ejaculation occurs, the ejaculant will be able to coagulate on the cervix and give those sperm a chance to swim up and get a chance of finding an egg to create pregnancy. Okay, you'll have prostaglandins, and what those guys will do is those will cause reverse peristalsis of the uterus. So as the semen get into the uterus, this is going to cause the uterus to contract and pull the semen in closer to the ovaries. Next one, prostate. It's going to encircle part of the urethra. It makes a milky, slightly acidic thing. Milky, slightly acidic substance, and the big role that this is going to do is it's going to have enzymes to activate the sperm. They get the sperm ready to swim once ejaculation occurs. Then the last one is bulbourethra. Bulbourethra is going to produce a thick, clear, mucousy fluid prior to ejaculation. What that is meant to do is that is meant to prime the vagina and cervix for the entering sperm. So here we go. Here's the penis cut. Alright. So we got our corpus cavernosum, are these two circles here, and corpus spongiosum is this right here. So corpus spongiosum is around the urethra, hence it is called the spongy urethra. This muscle right here is called the cremasteric muscle. Okay. Outside of that cremasteric muscle we have something called the external fascia of the spermatic cord. Okay, and as a whole once we have the external and internal fascia and everything, we'll call it the spermatic cord. Okay, so here's the testes, here's the epididymis. You'll have the scrotum. The scrotum is going to be one layer of skin and one layer of muscle. The muscle is called the dartos fascia. So the whole purpose of this, of the cremasteric muscle and the dartos fascia, is going to be to keep the sperm, to keep the testes at a regular temperature. They're going to want to be slightly cooler than normal body temperature. So when it's hot, if the testes are getting warm, what will happen is these muscles will relax and try to let the testes move away from the body. If it's cold and the testes are in a cold environment, what happens is these muscles contract and they pull the testes closer to the body to help keep them warm. Okay, we're looking at blown up testes here. Okay, so here's the testes. Inside here, we're going to have what are called lobules of seminiferous tubules. So all these tubes in here are called seminiferous tubules. They're broken up into lobules. Do you see how there's nice sections here? Okay, all these guys will drain into this, which is called the rete testes, and then the contents will move over to the epididymis, which has a head, a body, and a tail. Alright, so what we have right here, we're taking a cross section of a seminiferous tubule. So we're looking inside the tube of a seminiferous tubule. And if you notice, we have the gist of what's going to happen is we have actively dividing cells on the very, very most outskirts of this tube. And what happens is as those cells divide and they begin to mature and they move into the midline, they are becoming sperm cells. Okay, and once they're close to maturity, they'll move into the tube and be ready to move on their way. On the surface of the testes itself, there's going to be the tunica albuginea, which is shown here. On top of the tunica albuginea, there's going to be the tunica vaginalis. Okay, so we're taking a superior view here now. So we have the bladder here. You're going to have the seminal vesicle, and you're going to have the ampulla of the vas deferens. So we make the sperm in the seminiferous tubules, comes to the head of the epididymis, goes through the body, goes to the tail, travels up the vas deferens, and then we can keep some here in the ampulla. When ejaculation occurs, we get constriction of the ampulla of the vas deferens and the seminal vesicle. Those guys meet up in the ejaculatory duct. The contents pass through the prostatic urethra, where the sperm cells are activated. Then they pass through this membranous urethra, and then it goes through the spongy urethra. Alright, and here's another rendition so you can see. Here's your corpus cavernosum, and here's your corpus spongiosum. The urethra passes through the corpus spongiosum, hence the name spongy urethra. Okay? So, there's two types of cell division, mitosis and meiosis. When mitosis occurs, you get two identical daughter cells. One cell divides and it makes two identical matches of itself. When meiosis occurs, you're going to end up with 4 daughter cells, and each of those daughter cells has half of the genetic information is the parent cell. And what also occurs is that genetic information gets mixed up. So mom makes eggs, dad makes sperm. Each of these have half of the genetic information that mom or dad might have. So what happens is mom and dad's sperm come together, mom and dad's sperm and egg come together, we get fertilization, and now we have something that can have the same amount of chromosomes as mom and dad and can develop into a fetus. So in mitosis, you get a mother cell, it replicates, and it makes 2 daughter cells. They're exact same genetic copies. In meiosis, what happens is we'll go through 2 phases, meiosis 1 and meiosis 2. In meiosis 1, we take half the chromosomes and put them in one cell, and we take half the chromosomes and put them in another cell. In meiosis 2, we take those chromosomes and we split them in half. Alright? So each of these chromosomes have a double dose of genetic information in them. So all you need is just one side of this that I'm showing you right here, and that has all the DNA of one chromosome. But this is technically one chromosome because it's held together right here. So when you pull these apart, they look like that. Okay, so spermatogenesis. So we're looking in that seminiferous tubule again. It's going to begin closest to furthest from the lumen, and as those cells develop, they push outward. Alright, so we're going to have some support cells here, which are called our Sertoli cells. Alright, the function of the Sertoli cells are going to make nutrients, and they're going to have signals to start the process of spermatogenesis, which is making of sperm cells. There's going to be two compartments. Alright, there's the basal compartment, which is this up here, and there's going to be the adluminal compartment. There is a blood testis barrier, and there is no blood in this area. And the reason why is that the blood is going to recognize sperm as foreign invaders. So we don't want blood getting in here and seeing the sperm and having an immune response against our sperm cells, because they need to be able to survive. So just as the sperm, we start off with our two end cells here. It starts to divide. Once we leave the basal compartment and we come into the adluminal department, we can have meiosis 1 occur. So this is where meiosis occurs. So we split half the DNA there, half the DNA there, and what you'll notice is in mitosis, one mother cell makes two daughter cells. In meiosis, one mother cell makes four daughter cells. That is for spermatogenesis. Alright. In oogenesis, the production of eggs for females, there are 4 cells, but only one of them is typically viable. Okay, so as the sperm is progressing and maturing, we start off with a little nucleus. The sperm will start to get a tail growing on it, alright, and all this excess cytoplasm gets removed. You remember I said the sperm doesn't have a lot of extra energy in it because it doesn't have much cytoplasm there, so it rids all the excess cytoplasm so it can be quicker and more aggressive to get to the egg. So the parts of the sperm, there's the head, the midpiece, and the tail. Head carries the genetic information, midpiece is a motor, and the tail just whips around. And then on the top of it, it has a little hat called an acrosome. What the acrosome is it's an enzyme coat that when the sperm comes in contact with the egg, it can burrow and break a hole through it so it can get into the egg. So semen is going to be a mixture of sperm and accessory gland secretions. Alright, we talked about fructose is there because the sperm are small and they need an energy storage source for when they are on their long journey to find an egg or an ovum. It is also going to be there to protect the sperm, so we'll have alkaline substances there to decrease the acidity of the vagina, so the sperm are going to be protected. There will be secretions from the prostate gland to activate our sperm, and there will be prostaglandins that will be there to cause the reverse peristalsis of the uterus to help pull the sperm in towards the fallopian tube and towards an egg. There will be semen. Like we said, there will be alkalinity to neutralize the acid environment in the vagina, and then our antibiotics. Those will be there to kill any bacteria in the vagina that can act as competition for the sperm cells. And then there's going to be average ejaculation will be about 2 to 5 mLs, and there's between 20 and 150 million sperm per ml. So there's lots and lots of sperm. Okay, so we have this. So brain testicular axis. We're going to start off with GnRH, which is gonadotropic releasing hormone from the hypothalamus. That's going to be released, and that's going to affect our anterior pituitary. Okay, this is going to happen in cases when we have low levels of testosterone. So we will release gonadotropic releasing hormone, GnRH. Our gonadotropic hormones are FSH and LH. LH stands for luteinizing hormone. FSH stands for follicular stimulating hormone. LH is going to stimulate your interstitial cells, or Leydig cells, Leydig cells, to produce testosterone. testosterone will go off to the tissues, and it will go off to your spermatic cells, alright, or spermatogenic cells, and it will go off to the hypothalamus. It will tell the hypothalamus to stop releasing GnRH. And when it goes to the sperm cells, or spermatogenic cells, it is going to induce them to start the spermatogenic process. FSH will induce the release of androgen binding protein, which will come in contact with our spermatogenic cells, and what that does is that enhances the binding of androgens, which is testosterone. So with androgen binding protein, our spermatogenic cells can have a much easier time taking up the testosterone, so they can be much more effective. Now, female anatomy. So here we'll have our ovary. On the ovary, we're going to have the uterine tube, or the fallopian tube. All right, so there's going to be numerous different parts to it. First off, coming off of it, these little finger-like projections are called fimbriae. This part right here, this enlargement, is called the infundibulum, and then it turns into the fallopian tube. Okay, and the fallopian tube will come in and be in contact with the uterus, which is right here. All right. With the uterus, it's going to have a couple layers to it. There's the perimetrium, which is the outer layer. There's a thick, smooth muscle layer, which is called the myometrium. And then there's an inner layer called the endometrium. The endometrium will have a basal and a functional layer to it. The basal layer is where implantation will actually occur in the case of pregnancy. The entranceway to the uterus is the cervix, which is this right here. All right. Coming down, this is the vagina, or the canal of the vagina. This shows the remnants of a ruptured hymen. Here's the labia minora, or minus, and here's the labia majora, or majoris, or majus. This is the clitoris. Okay, so we are looking at an ovary right here. So in the ovary, the development of a follicle is going to be different than the development of a sperm cell. So basically what happens is we start off with these primordial follicles. Okay, primordial follicles, once a month, one of those primordial follicles will be chosen. First off, I should let you know that before you're born, you have all the primordial follicles you'll need. Okay, you're born with a couple million or a couple 100,000 primordial follicles, and that's all you're ever going to need. You never get new ones. So when doctors recommend women to have children before a certain age, the reason why is these cells have been in arrested development since before birth. And once you hit monarch, which is you have your first cycle or period as a female, what happens is for the first time, one of these cells is chosen. One of these primordial follicles are chosen. Okay, so when one of these cells are chosen, there is a small FSH surge. Okay, one of these cells are chosen, it turns into a primary follicle, and it starts developing into a secondary follicle. And as you see, do you see this fluid line here? As the cell is growing, as the secondary and primary follicles are growing, they start to produce estrogen. Alright, as it starts getting really bigger and it gets this big antrum here, it is producing high levels of estrogen. Then what happens is the cell grows and grows and grows, and ovulation occurs. When ovulation occurs, this basically ruptures like a ripened piece of fruit, and it spits out the oocyte. The remnants of our follicle turn into something called a corpus luteum. The corpus luteum is going to be there to produce progesterone. Progesterone will help the uterus prime and stay ready to carry a fertilized egg. Okay, looking at anatomy again. So here's the ovary. All right, we choose a primordial follicle. It goes to a primary follicle, secondary follicle, and it turns into a. It's going to turn here. We'll see it here. It'll turn into a vesicular follicle, and what'll happen is the vesicular follicle ruptures. We have our fimbriae, those finger-like projections there. They're to almost catch the oocyte. The infundibulum is like the palm of the hand, and it'll catch that oocyte, and it'll help sweep it along the uterine tube, or the fallopian tube, on its way into the uterus. Okay, and sometime throughout this pathway is when fertilization likely occurs. So with the uterus, there's the fundus of the uterus, the body of the uterus, right? There's going to be the isthmus, which is going to be the connection between the cervix and the body of the uterus. And with our uterine wall, we already said there's the inner layer, which is the endometrium, this muscular layer, which is the myometrium, and the outer layer, which is the perimetrium. So looking at the uterine wall, your innermost layer is the endometrium. Okay, the endometrium will have two parts: the stratum basalis and the stratum functionalis. Stratum basalis is like the basement; it is always there. Stratum functionalis, it will grow and it will slough off once a month. So when a female has her cycle, the menstruation, the bleeding that is occurring, is because of the sloughing of the functional layer of the endometrium. So here's a representation of a hymen. Alright, these are vestibular glands. Okay, this will show the greater vestibular gland here. Alright, and the bulb of the vestibule. This area in here is considered the vestibule. So once again, our primordial follicles, we have all those we need before you're born. Once you hit monarch, or you have your first cycle, a primordial follicle is chosen and it becomes a primary follicle, develops into a secondary follicle, then a vesicular follicle. So here's our primordial follicle, primary follicle, secondary follicle, and our vesicular follicle. Alright, as this follicle grows, as that follicle grows, the estrogen levels start to increase. When you have very, very high levels of estrogen, that causes a large spike in LH. The large spike in LH induces ovulation. Okay, so that large spike in LH will induce ovulation. Then the remnants of the vesicular follicle turn into our corpus luteum, and that is producing high levels of progesterone. So the high levels of progesterone, what those will do is those prevent the release of FSH and LH. Okay, and that's also going to help with the development of our functional layer. So we're going to have the brain ovarian axis, kind of like the brain testicular axis. So in levels of low estrogen, the hypothalamus will release GnRH. GnRH will induce the release of LH and FSH. Okay, and our first small bump right here of LH and FSH. FSH is this is LH. So our first small surge of FSH induces the primordial follicle to become a primary follicle. Okay, so the LH and FSH cause our primordial follicle to become a primary follicle. Follicle grows, becomes a secondary follicle, and then a vesicular follicle, and as it gets bigger, it produces high levels of estrogen. The high levels of estrogen make a huge surge in the LH and FSH, and that huge surge in LH and FSH induce ovulation. Okay, then the remnants of that vesicular follicle turn into the corpus luteum. That makes low levels of estrogen and high levels of progesterone. The high levels of progesterone completely inhibit the release of LH and FSH. Why is that important? Because if we're not releasing LH and FSH, you cannot choose another follicle to have another oocyte released. Okay, why is that important? Because I don't know of a single woman out there that is 4 to 5 months pregnant that wants to get pregnant again with another baby, and I don't know that your body would really be able to handle that. So not good stuff. Alright, so here you go. This shows the estrogen. So the estrogen levels are low. One of those one of those primordial follicles start to grow, and as it starts to grow, the estrogen levels go up. Right after we peak our estrogen levels, boom, we get our LH surge. That causes ovulation. Then the estrogen levels start to die off because our oocyte is no longer around, and then that corpus luteum takes over and it starts to produce progesterone. Okay. Our corpus luteum will stay around and continue to produce progesterone for just a short period of time, just a couple days, maybe about 10 days or so. If fertilization occurs, then that fertilized egg will produce HCG, human chorionic gonadotropin. And what that'll do is that'll keep this corpus luteum around and let it develop and let it keep releasing progesterone. The reason why we want to release the high levels of progesterone, once again, let's go back here. High levels of progesterone will inhibit the release of GnRH and LH and FSH, so you don't get pregnant with a second baby. Okay, so primary follicle, secondary follicle, vesicular. So as with our phases, menstrual phase is going to be the beginning. Okay, so menstrual phase, you are sloughing off this functional layer. In proliferative phase, the primary follicle and secondary follicle are growing, and they are making higher levels of estrogen. All right, you get your LH spike, which causes ovulation. The oocyte is released, and now you're in your secretory phase. So the endometrium is primed for fertilization. You can have fertilization of the oocyte, and it can implant, and it can begin to grow healthy inside of the endometrium. As for the STDs on here, just read them and take them for what it says for your study guide.